Joining us today. I'm glad to be joined by General Matt Quinn, Executive Director of my COVID-19 Task Force, and Becky Kirsch-Winner, DPHHS Communicable Disease Control and Prevention Bureau Chief and the Immunization Program Section Supervisor. She's been ordering all the vaccines and making sure they get out to the right folks. Today we wanted to give you a brief update on Montana's response to the COVID-19 pandemic, specifically on our approach to vaccinating the most vulnerable Montanans. Improving Montana's response to COVID-19 has been my top priority since I became your governor. It's why, on my second day in office, we adjusted the state's vaccine distribution plan to prioritize and protect the most vulnerable. Montana was on the cutting edge in this approach. A week later, the federal government followed suit and issued similar guidance. Prioritizing Montanans who are most vulnerable to the serious complications or death from COVID-19 is just common sense. When we initially established Phase 1B, the eligible population accounted for 75% of deaths and 50% of hospitalizations from COVID-19 in Montana. Every shot Montanans administer is helping to prevent hospitalization and death. Every shot is making a difference and saving lives, particularly of our most vulnerable. And we have administered a lot of shots since we moved into Phase 1B. Since January 19th, Montana has administered more than 200,000 doses and more than 260,000 doses since December. Our healthcare workers are achieving tremendous efficiencies in getting these shots into arms of our most vulnerable citizens. And we are seeing encouraging increases in our vaccine supply. Yesterday, I announced that the state is slated to receive 8,700 single-dose Johnson & Johnson vaccines later this week. Counties will begin distributing this safe and effective vaccine next week, which is 100% effective in preventing death. Because this vaccine doesn't need to be stored at extremely low temperatures, we're able to distribute it more easily across Montana. This is great news as we continue to work to protect our most vulnerable. As you know, our dedicated state employees at DPHHS have been working closely with local jurisdictions to track their progress through Phase 1B. In a recent survey conducted during the week of February 22nd, the state received encouraging updates from jurisdictions on their 1B progress. The majority of jurisdictions estimate they are more than 50% of the way through 1B in their communities. 14 of the 52 jurisdictions estimate they're even farther along, more than 75% of the way through their estimated 1B populations. As we've been getting shots in arms, hospitalizations and deaths are on the decline. So are positive cases. Our efforts to protect the most vulnerable are working. To build upon our progress and to continue to save lives in our response to this pandemic, the state of Montana will expand Phase 1B. As I indicated earlier, we follow the data to determine and execute a plan focused on protecting Montanans most susceptible to serious complications from the virus. The existing Phase 1B population accounts for 75% of deaths and 50% of hospitalizations from COVID-19 in Montana. We'll continue to follow the data to protect the most vulnerable Montanans, which is why, effective Monday, March 8th, the state will move into Phase 1B+. In Phase 1B+, COVID-19 vaccines will be available to Montanans 60 years of age and older and Montanans between 16 and 59 years of age with additional underlying medical conditions like asthma, cystic fibrosis, and liver disease. With this expansion, we are prioritizing population groups which account for nearly 90% of Montana's total deaths and more than 70% of Montana's hospitalizations during this pandemic. Through this thoughtful, data-driven, common-sense approach, we will continue to minimize hospitalizations and deaths from this virus. We're continuing to prioritize our fellow Montanans who are susceptible to serious complications that we know this virus can cause, including death. Montanans have been remarkably patient as we wait for more supply from the federal government. My priority remains ensuring that every Montanan who wants the vaccine can get the vaccine. We won't stop working till it's accomplished. It's important to note that in entering Phase 1B+, our timeline for Phase 1C remains the same. We anticipate 1C, which includes frontline essential workers not already vaccinated in Phase 1B or 1B+, is still estimated to begin late spring or early summer. While I wish every Montanan who wanted the vaccine could get one today, the reality is that our supplies are very limited. The best thing we can do for our neighbors is prioritize Montanans who are most at risk of serious complications or death from this virus. And that's what Phase 1B and Phase 1B+ do. Now I want to turn it over to Becky, who will explain how the state orders vaccines and how they're distributed throughout the state. Becky?
All right, thank you, Governor Gianforte. Good afternoon, everyone. As the governor mentioned, we're pleased to announce that we received news over the weekend that we were receiving 8,700 doses of the Johnson & Johnson vaccine for distribution across the state this week. Those 8,700 doses, along with nearly 24,500 doses of Pfizer and Moderna for first dose administration, and along with 21,000 additional doses for second dose administration, means that we're going to get nearly 53,000 of them to be administered as soon as our providers can get them into the arms of the Montanans. This is great news as we continue vaccinating our most vulnerable Montanans. So each week, we're notified by the CDC for the allocations for Montana. This usually happens on Tuesdays, and I'm really pleased to report that each week, Montana maximizes their allocation and orders every vaccine that's available to us. Once we're notified of that allotment, we work with the jurisdictions across the state to determine how to best allocate those vaccines to each and every jurisdiction. This process goes on each week since December to make sure that we get equitable distribution across the state of Montana. So this week, we'll learn our final allotment probably later today, and then we'll begin the process all over again. But I really want to give a shout out to all of our providers out in the state of Montana that are giving these vaccines. They're doing such a great job of getting the shots in arms quickly and as soon as they arrive. So with that, I'll turn it back over to Governor Gianforte. Thank you.
Thank you, Becky, and thank you for your work during this difficult period to get vaccines out to folks. Appreciate it. To reiterate, the state will be moving into Phase 1B+ next Monday, March 8th. I encourage Montanans who are eligible for Phase 1B+ and who are interested in receiving their vaccine to visit covidvaccine.mt.gov for more information. There you can find info regarding COVID-19 vaccine availability and scheduling in your area. I also ask Montanans to help one another. If you have a loved one or a neighbor who doesn't have internet access or who needs help scheduling a vaccine appointment, please help them. We'll get through this together, neighbor helping neighbor. Finally, I encourage Montanans to get one of these safe, effective vaccines when they're able. When my name is called, I'm going to get one. Every time a Montanan gets a vaccine, it helps put us one step closer to our normal life. And with that, I'll open it up for questions for me or Becky or General Quinn. Holly?
Hey, thanks for doing this availability, Governor. I don't know if this is best for you or Becky, but and if I got this wrong, let me know. So you were saying about, or I guess the breakdown of jurisdictions, I'm wondering if you know which by counties are about halfway through 1B, and then which of those, like which of the 14 that are further along?
General Quinn, Becky?
I'm sorry, I actually did not bring that data, and we can get it to you as soon as we're done here.
Okay, do we have an online question?
Hi, this is Perrin Stein from the Bozeman Daily Chronicle. I was wondering if you knew how many people were in Phase 1B plus in Montana, and also how, given the limited supply, we're able to expand the Phase 1B without pushing back the timeline for Phase 1C.
Thank you, Perrin. I'll have General Quinn address that.
Yeah, so as we looked at 1B plus and the focus on continuing to take care of the most vulnerable, we looked at that population within that age group. We did an estimation on how many in that age group would already have been included in the vaccination due to 16 to 69 with serious underlying conditions. And then we looked at a possible uptake. So we're thinking it's about 100 to 140,000 individuals would be included in this expansion. And as we continue to see vaccines increase, the supply coming into Montana, that's how we're confident that that timeline would stay along the same route.
And I would just add, we've seen significant uptick in the manufacturing and the allocations we've been getting. And that's encouraging. As Becky noted, we'll receive over 50,000 doses here in the state this week. So we got to keep putting needles in arms. Jonathan, did you have a question?
Thank you. Thank you, Governor. Yes, Jonathan Anberry, Montana Television Network. I was wondering if you guys at the state level are making any kind of advisory as far as where the Johnson & Johnson vaccine should be directed. It should be used differently in light of the different characteristics that it has.
Yeah. Good question, Jonathan. As you know, it's a 1-dose vaccine, not a 2-dose. Also, it does not require the super low temperature storage. Who would like to address the question how we're doing allocations? Yeah, General Quinn.
So a couple things that as you look at the CDC response to that same question, they're getting that same question. You know, as they went through the EUA process for both Pfizer and Moderna back in the December timeframe, and now here we are in March that they went through the EUA. So the COVID-19 has changed. There are variants out there, and frankly, Johnson & Johnson was tested against those variants that we didn't have when Moderna and Pfizer. And so that's why the guidance is, and you heard Governor Gianforte say, take the vaccine that's offered to you because the efficacy of them are good, and 100% death protection for the Johnson & Johnson as well. So again, recommendation is take the vaccine that's offered.
Good. We have another question online.
Hi, Governor Gianforte. This is Rachel Kramer at Yellowstone Public Radio. I was curious who's covered under the frontline essential workers, and is there a list that would detail that?
That is the definition, the 1C definition from the CDC. Am I correct in that? Yeah, that hasn't changed with this announcement. Thank you, Rachel. Hala, did you have a follow-on?
Yeah, I was wondering, General Quinn talked about variants, and I'm wondering if there's been any variants that we've seen in other states that have been concerning in Montana yet, if you've noted any of those.
Holly, thanks. So we have not detected variants yet. We are testing, and MSU has expressed concern about a couple that have been sent on for further verification, but until we get that verification back, there's been no variants detected in Montana through our testing.
And then, I don't know if this would be best for you. I'm wondering about what the uptake rate has been in Phase 1B so far.
Yeah, so depending upon which area you're in Montana, certainly you're going to see different. But the percentage that we used in order to calculate the uptake rate or the population of 1B plus was about 75%. We want to make sure that we've got the vaccines for 1B plus.
Okay, we'll take another question online.
Hi, Governor Gianforte. This is Freddie Monadas of Bozeman Daily Chronicle.
Hi, Freddie.
Thanks for holding this call. Yeah. I had an unrelated question. I was hoping to talk about Senate Bill 140. It passed both chambers of the legislature. I was just wondering if you planned on signing that bill, and how would that affect judges who are awaiting Senate confirmation who were appointed by former Governor Steve Bullock?
Okay, and remind me what 140 is. We have a couple thousand bills moving
I'm
through.
sorry, yeah. It would abolish the Judicial Nomination Commission and give the governor authority to appoint interim district court judges and Supreme Court judges.
Yeah, I'm going to consider every bill that gets to my desk thoughtfully. I think my understanding of that bill, I haven't seen the final form yet, but it just implements what our Constitution says, and we're inclined to support it. Yes?
Yeah, hi Governor. I'm curious about, I'm thinking back to a press conference a couple of weeks ago. You called on the Biden administration to send more allocations of the vaccine to Montana. I'm just curious if you have thoughts now on where we're at with that, if you feel like that call has been answered, or can I get an update on that?
We have reached out to the Biden administration. I was on a call earlier today with administration officials. We made it very clear we did not think that we were getting our fair share. We were at 45th out of 50 states in per capita allocation. The number of allocations, the Biden administration did respond to our call, including us in the federally qualified health center allocation. We got the Missoula Center added, so I would thank them for that. I still think we're owed more vaccinations. The increases that we've been getting have been more due to the fact that Pfizer, Moderna, and now Johnson & Johnson are ramping up their production, and we're still getting the same percentage, but it's a larger number. So that's good news for Montana. We'll take another one online.
Hi, Governor. Keith Schubert from the Daily Montanan here. Thanks so much for hosting this. I was wondering if you have any concerns about recent warnings from federal health officials that fully reopening and easing restrictions may cause us to lose the ground that we've gained.
Yeah, and I'm really pleased with the progress we're making here in Montana. We continue to see hospitalizations under 100, continued declines in new infections, increasing number of people vaccinated, and I think most Montanans know how to, with good guidance, to protect themselves and their loved ones, and I'm encouraged by the progress we're making. Is there another online question?
Hi, Governor Gianforte. It's Rachel Kramer again with Yellowstone Public Radio. I was just looking at the CDC recommendations for Phase 1B of frontline essential workers, and it does list grocery store workers, public transit workers, teachers, support staff, daycare workers. So I'm just curious if you can explain a little bit more about why they're not included in Phase 1B+.
Sure. As I explained in my comments, we're really focused on protecting the most vulnerable, those who would have complications from the virus or death. With this expansion to 1B+, we're now including close to 90% of all Montanans who would suffer severe complications or death from the virus. I think that has to be our priority. I wish I had a vaccine for every teacher and frontline worker right now. We don't have enough, but I'm encouraged by the increased allocations. Hopefully we'll get to them very soon. Are there any more questions in the room here? Jonathan.
Thank you, Governor. Jonathan Amberian again. I wanted to ask if you could clarify a little bit on the 8,700 Johnson & Johnson doses. Is that part of this week's allocation? As we said, usually on Tuesdays we're getting an idea of what our allocation is.
Becky's my expert on numbers of vaccines.
Yes, I'd be happy to take that. So typically in any given week we get our allocation Tuesday the week previous to when it ships. Because the Johnson & Johnson vaccine was new this week, we did not receive our allocation until this last weekend. So we were able to, after the authorization was complete, we were able to order it this week with it anticipating being shipped later this week at that time. So it's included in this week. So it's just a little off cadence.
So then the idea is that next week we'll have a chance to order another batch of this Johnson & Johnson, most likely?
Yeah, we're not sure about that yet. We're still waiting a word from the CDC and what the allocations look like. It looks like we may potentially have a slowdown in the Johnson & Johnson vaccine, but certainly we're watching that closely. And like we said, we get our allocations on Tuesdays of each week, although we're not sure how the Johnson & Johnson vaccine is going to fall in.
Thank you.
And I would just, Jonathan, I would note that Johnson & Johnson has been manufacturing that vaccine. They had warehouses full of it. This initial shipment is probably larger than subsequent shipments. Okay, so it's an initial bump that's good. I mean, we got 8,700 doses. I wouldn't anticipate that much in the near future again. It'll be a lower amount that'll then start to climb, just like we saw with Pfizer and the Moderna as well. Holly.
Yeah, I just had a question kind of following on Freddie's about Senate Bill 140. There's 3 nominations that the previous administration had made to judicial districts around the state that are sitting waiting for the legislature to take up right now. I'm wondering if you'd like to see them take those up or not.
That'll be a decision made by the Senate.
And then one more question too, back to COVID. I know we talked about this before, but have you ever gotten an explanation for how doses are allocated and why we're so low? Has that ever been articulated?
It hasn't. Is there an online question?
Hi, Governor. It's Stein from the Bozeman Daily Chronicle again. I was just wondering about Phase 1B+. Will it be like when we entered Phase 1B where counties can or other jurisdictions can determine whether they open it up to a subset of that phase at first pending supply? Will they have that kind of discretion again?
Yeah, thanks, Perrin. I'll let Becky describe that.
Sure, of course, I'm happy to describe that. So in our current Phase 1B, we still have some counties that are still working on their very most vulnerable, including those 70 and older. So we would anticipate they would do some tiering within their county to make sure that they reach the most vulnerable first before moving on to the next. And so we would potentially see, especially in some of our larger counties, some sub-prioritization occurring as well.
Do we have any more questions online? Yeah, okay.
Hi, Governor. It's Rachel Kramer again, Yellowstone Public Radio. So even as the vaccine is becoming, or multiple vaccines are becoming available, health experts say that testing, along with masking and hand washing, remain one of the best tools to stop the virus from spreading. And so does the state have any plans to reinstate asymptomatic testing events or increase testing?
You're right, testing is important. The guidelines that we have for social separation, mask wearing, hands washing are all still important components of minimizing the spread of the virus. That being said, I'm very encouraged by the trend lines we see in hospitalizations and new infections. So I just ask Montanans to continue to look out for themselves and for their neighbors. And with that, we'll conclude today's press conference. Thank you for being here.